Ladies and gentlemen, it is our pleasure to introduce Partners in Care Foundation President and CEO June Simmons and Board Chair Marta Fernandez.
Well, wow, here we are. We did it. Congratulations, we're in person. So a warm welcome to everyone, and thank you so much for joining us and celebrating the 21st Annual Vision and Excellence in Healthcare Leadership Tribute Dinner, a proud tradition, and we are thrilled to be the first major event in person. So you're all heroes, back together, face to face, in this great gathering of top leaders. And a special welcome to our very supportive virtual audience of 100 plus people who are joining us on Zoom. Yay! Because this celebration is both virtual and in person, we have the ability to record it. And so it'll be available for later viewing a few days from now on the Partners in Care website. A quick note about tonight's event, a little different format. It will unfold in 3 sections. The first is underway now and will culminate in our presenting the Lifetime Achievement Award to Dr. Paul Torrens. And then we will break for dinner because we thought you'd be hungry. When our meal is finished, we will start up again to present this year's Vision and Excellence in Healthcare Award to Paul Viviano. And as you know, we are here to honor 2 amazing individuals and recognize the tremendous leadership they have provided within California's healthcare community throughout their impressive careers. As with each of the other individuals who've been honored with these awards before, both Paul Viviano and Dr. Paul Torrens exemplify the characteristics that led to their selection. So you'll hear more about each of them, each of these accomplished men throughout the evening. But right now, I'm very pleased to introduce Marta Fernandez, the board chair of Partners in Care Foundation. Marta's been dedicated to supporting Partners' mission as a board member for over 16 years. She's a law partner with Jeffers, Mangels, Butler, and Mitchell, where she heads the Labor and Employment Department and has provided legal services to healthcare institutions throughout California throughout her career. Marta?
Thank you, June. It's an honor to be with you all tonight and with you, June, to celebrate the accomplishments of our organization and our distinguished honorees, Paul Viviano, CEO of Children's Hospital of Los Angeles, and Dr. Paul Torrens, Professor Emeritus of Health Policy and Management and the founder of the Paul Torrens Health Forum at UCLA. It's a particularly special honor for me, as I know these 2 individuals personally, and I've worked with Children's Hospital for many years. Both of these heroes have applied imagination, experience, and significant talent to their unique organizations. They are tenacious advocates for their vision and agents of change among us, qualities that we also believe at Partners in Care. And we started 23 years ago. Through the vision of founder June Simmons and the founding board, Partners became an innovating evidence-based models of care addressing a missing and significant component of medical care, the social determinants, which we know today are essential to sustaining health, contributing to recovery from illness, and are key in maintaining a longer and higher quality of life for those with chronic medical conditions. While the work of Partners is directed towards and needed at all social economic levels of medical care. We also know that this work is necessary and particularly impactful at this time and in those communities with economic need, where failing and underfunded programs create even greater urgency to address on a wide scale the social determinants that impact health. What a radical idea it was 23 years ago that social determinants could impact health. June was truly a social disruptor. Who knew? But today, social determinants and their core role in the continuum of care are discussed everywhere, in hospitals, medical practices, health plans, and even in government. I'm very proud to be associated with Partners in Care, which through its wide network of partnerships has used 23 years of experience to provide its proven models of care across our region and across the country and impact the lives of millions. That is why the theme of tonight is "The Time Is Now," because we are in a transforming environment where the redesign of health includes alignment and implementation of initiatives that respond to the social determinants of health. Well done, June and our team at Partners. It is now my pleasure to introduce the honorary tribute co-chairs who helped make this event possible. They are Tom Prislak, President and CEO of Cedars-Sinai Health System. I like the music. President Castulo de la Rocha, President and CEO at Altamed Health Services. And John Bacchus, CEO of LA Care Health Plan, who unfortunately could not be here in person tonight. Castulo, could you please join me on stage? Before I turn it over to Castulo, I'd like to thank him and Altamed for its diamond-level sponsorship for this event. Thank you, Castulo.
Thank you very much. It's indeed a pleasure to be here with all of you. Most of us are out of practice, including myself, so bear with me as I work myself through these 2 minutes, difficult as it is. Good evening. It is indeed an honor to be here for the recognition of Paul Torrens, who has been there for me on a number of important occasions. It is also a pleasure to be here on behalf of Altamed Health Services Corporation in support of Paul Viviano. CHLA is a key partner for Altamed, and Paul has been nothing but supportive of our relationship. Throughout the pandemic, he has remained present and visible and ensured that his hospital staff are taken care of. Since he came on board, our partnership has evolved dramatically, and we are proud to offer co-branding pediatric services at a growing number of Altamed clinics, including our site at CHLA. But right now, I'd like to direct your attention to several of this evening's sponsors. The generosity of our sponsors will continue to be recognized throughout tonight's program, here on the stage and on the screen. First, we would like to recognize our premier event sponsor, Children's Hospital Los Angeles. Please. We're warming up, guys. We're warming up here. Good. There's another reason to applaud. Children's Hospital has just been named by the U.S. News and World Report as the #1 children's hospital in California, numero uno children's hospital in the Pacific region, and #5, we're going to #1, but #5 now, children's hospital in the nation. Congratulations, Paul, to your staff. Congratulations, my dear friend. I see that we're warming up here. That's wonderful. Next, we would like to thank our five top diamond sponsors, beginning with Aetna, Ultimate Health Services Corporation. Somebody give applause for Ultimate Health Services here. Likewise, give an applause for Blue Shield of California, Children's Hospital Los Angeles Medical Group, Keck Medicine of USC, and Keck School of Medicine of USC. Your participation as a sponsor is critical to supporting the critical work of Partners in Care and addressing barriers to health equity among our most vulnerable populations. June, this is all for you. Congratulations on a marvelous evening. I know already successful, and for the incredible work that you do. Thank you very much.
Bravo. We're so happy to be joined in this room tonight with so many of California's finest healthcare leaders, and you know who you are. As I mentioned earlier, one of them can't be with us tonight in his absence. I'm subbing in for John Bacchus, who sends his regards, who was originally going to present our platinum sponsors. As John isn't here to say a few words about his organization, I thought I might do so in his absence. Since 2015, John has been Chief Executive Officer at LA Care Health Plan, the nation's largest publicly operated health plan, serving almost 2.5 million members in Los Angeles County. Other than that, they're not big. LA Care is dedicated to providing access to quality and affordable health care for LA County residents through a variety of health coverage programs. A national healthcare leader for more than 40 years, John has led health plans across the country, many of which focused on the underserved. And if he were here, John would tell you that helping to make this event possible are our platinum sponsors. And they are Cedars-Sinai, FMG Leading, HealthNet, Providence St. Joseph Health, and Richard Sanaiko. Thank you. It means a great deal in these times of suffering that we have all witnessed and lived through, and we thank you for investing in the safety net. All these sponsors are key partners who've not only supported this evening, but also support the vital ongoing work that we do.
Thank you, Costello and June. Partners Board of Directors are very important and very much involved in this organization's work. So I hope you will take this opportunity throughout the evening to ask us any questions or share your thoughts. All board members are listed in your program book, and here they are on the screen as well. May I ask my board, the Partners Board, and my friends to please stand up and be acknowledged.
And a great board they are. So as we've noted, this is Partners' 21st annual tribute dinner. And each year we've been fortunate to recognize an amazing individual healthcare executive for their stunning vision and excellence in dramatic and high-impact leadership. So we're very pleased to have a number of our distinguished and legendary past honorees here tonight. So as we call out your name, please stand. We ask the audience to hold your applause until all heroes are standing. Lloyd Bookman, Don Crane, Howard Kahn, Bob Lundy, Tom Prisalak. And I'd also like to call out those who are with us virtually, including Barry Arbuckle, Dr. Francine Kaufman, and our very first recipients, founding board chair, Dr. Alan Mathias and Wida Mathias, for whom the award was originally named.
Partners would also like to express our sincere appreciation to this year's dinner committee members for all their efforts in making this evening possible and bringing us together. And to Jack Schlosser, board member and chair of the Tribute Dinner Committee, for an awesome job. Could we have the members of our Tribute Dinner Committee please stand? You all know Partners has been the leading community innovator in the field of social determinants of health for 20 years. So it's my pleasure to share this video, Introduction to the Agency and its Services, made possible through the generosity of Children's Hospital of Los Angeles.
I think we can recognize now more than ever that healthcare is essential, and health really happens at home. How we live, how we care for ourselves and those we love. So we need to build a highway to really integrate what we call integrating medical care and social care so that they become one. And this gets us the best quality of life, the best health outcomes, and the best costs, incidentally. For the last several decades, Partners in Care has been part of the pioneering leaders across the country who've helped build evidence-based interventions for what happens at home, for self-care.
They're connected at the city, county, state, federal level. They work with managed care plans. They also work with the healthcare providers. And they are right at the heart of trying to find where the resources are best needed and how to work with them. It's a relatively small organization that has a big impact on people's lives.
As we see greater disparity in our healthcare system and how it impacts vulnerable communities, I think that we are poised beautifully to help create tremendous change and impact nationally because of the models of care that we've developed over all these 20 years.
Healthcare is critical, but there are social determinants of health. They've actually been researched for a long time, and they are things that really drive health outcomes. We invest huge resources in health treatment, and they kind of leak out the bottom. We utilize proven, evidence-based models of care, so we get consistent, solid interventions.
We all know how complex the healthcare system can be, especially if we are being cared for by different specialties, and oftentimes different providers are not speaking or communicating with each other. We act as a quarterback, so to speak, to help coordinate that part of it as well, which is essential to keeping that person on track.
Over the years, we have been part of identifying these critical problems that get people in trouble, developing solutions that can help empower them to be more successful, testing those through research, demonstrating them in practice, and then scaling them for adoption by others.
We provide long-term assistance through the development of patient care plans for people, seniors, disabled, and now children who remain at home long-term due to chronic conditions, social support, and other types of resources. We provide the network for the family as well as the patient to be able to remain at home.
These are people that in the past would have been institutionalized, and now through these programs are able to stay at home and thrive.
At Partners in Care, I am most proud that we continue to grow and evolve. We keep learning from the people we serve and seeing how others serve. What goes wrong in people's lives that can be remedied as transformation to really change lives, really free people of pain, really prevent preventable decline and illness.
For every individual that Partners in Care serves, there's a whole additional group, family members, friends, and actually other caregivers that are all interested in the well-being of that person. So when it works right, with the help of Partners in Care, the impact is far beyond actually the client themselves.
It is 20 years later, we are now at the forefront of this era of social determinants of health.
Let's continue together to impact millions of lives by recognizing the interconnected worlds along the healthcare continuum. So it's my distinct honor to bring to the stage our dear Jack Schlosser, whose counsel and patient guidance is chair of Partners Tribute Dinner Committee and part of our board, has brought us to this place tonight. Jack, would you please join us?
Good evening, everybody. I hope everyone is having a wonderful time. I sure am. It's so great to see so many friends and meet some new ones tonight. Before we proceed with tonight's program, I would like to take a moment and publicly thank Karen Schneider, Partners Vice President of Development, and her entire team for all of their tireless efforts and work that they put into this evening. And believe me, behind the scenes, and I'm sure you can imagine, they really went above and beyond the call to make sure we have a safe, enjoyable evening. So Karen, thanks for your leadership, and thanks to your entire team. So tonight is special on so many fronts. In addition to honoring Paul Viviano and his amazing work at CHLA and throughout his career, this is the second time in the 23-year history of Partners that we've bestowed a Lifetime Achievement Award, the first honoree being Dwayne Downer. Tonight, we celebrate Dr. Paul Torrens, and how fitting it is to honor him in this way. Those who have had the good fortune to know Paul have witnessed decades, literally decades, of consistent, selfless, brilliant contributions to individuals and organizations. I've known him for nearly 50 years. He and I arrived at UCLA in 1972. He is a professor of health services policy and management, and I as an MPH student. He was my advisor, and we have stayed connected to this day, and I'm blessed to have him connected with me through all those years. This pattern of sustained connectivity, I know, has been shared between Paul and so many in this room and those joining us virtually. That's just the way he is. He is not only a great academician and thought leader, but an exceptional and generous mentor, coach, and human being.
When you think about the impact that professors have, teachers, the impact can be remarkable with the right emphasis, the right place at the right time. And all of us can remember great teachers, great professors that have impacted us for this little slice of your career or your development. What makes Paul so unique and so special is that longitudinal view of always being there to help shape and support and be a cheerleader, to ask the hard questions, to introduce.
Paul's made an incredible contribution to healthcare He's been a great mentor to so many students. I can't even imagine what the total number is.
For students of Paul Torrens, you knew that not only did you benefit from interacting with him as a student in the class, but you had a mentor for life.
If anybody here who has been mentored by Paul and then in turn mentored anyone else, please stand up.
But for making my life so rich and full, because it works both ways. And I'll take all the credit that you want to give me. It's been that kind of economic market, so,
There's a very elegant, gentle brilliance that really impacts and has really helped to lift major healthcare leaders throughout Southern California and across America. A tremendous impact that he's had on building professional capability and values into people who make a real difference where they work and lead.
If you've heard that Paul reminds others of Rudolph Valentino or George Clooney, I would say that those are both accurate. He not only possesses leading man looks, but he also captures the room when he walks in.
Just looked like the kind of person that is just totally together. And we found it as students. We found him to be just inspiring and just a terrific professor.
Think of Paul Torrens as brilliant, charming, engaging, inspiring, physician, leader, knowledgeable, influential, and somebody you wanted to get to know.
If cult was a good word, we'd have one for him because he's that distinctive.
I think what makes a great leader is somebody who has the fire in the belly and the personal characteristics and charisma and caring that comes across so clearly, and that's Paul.
He was hired by the governor as part of the University of California to run the tobacco tax initiative in Sacramento. So Paul would commute back and forth from LA to Sacramento, running two things: health policy program at UCLA, as well as the governor's University of California tobacco tax initiative, which was designed to help support healthcare initiatives in the state.
He is a guy who always has all of his fingers on everything that's going on. He reads a lot, he knows what's going on in the field, and he is able to take all of that information and synthesize it down to your critical nugget of what's really information that you need to know.
He always approached things very objectively, and he also always involved external speakers, people from the community that would bring real-life examples to the situation.
That ability to influence without being directive, to be thought-provoking without offending, to bring out the best in people without them even knowing it, is kind of that leadership style that Paul brings to everything he does.
The most important characteristic that a good leader can have is listening, truly listening. And I learned that in real time from Paul.
He was available to any student anytime, and you could always look, and he was laser beamed on that student, trying to figure out what he could do to be helpful.
He has actually served multiple generations of healthcare leaders, and that again is unique.
In how healthcare management, healthcare policy developed over Southern California over those decades. It's just not possible to have a bigger reach, to have left bigger footprints than Paul Torrens has.
He is a leader in every sense, but he's a humble leader. And it's not about him, it's about his students. And that's really a great model for all of us.
I cannot think of anybody that has impacted my own personal career more than Paul.
People remember him most because he cared so much.
And his being there for all of us is part of his legacy for everyone who've come in contact with Paul.
And he was meant to do this because of the impact that it would have on the community and the impact it would have on the lives of the leaders that in turn would be prepared to impact the health of the community. And so he wouldn't want to talk about himself. He wouldn't want to hear about this. So it's great to have the opportunity to say these things.
People will come for him because he's special. He's just, he's beloved.
Now that you have seen why Paul Torrens is so beloved, I'm happy to be joined at the podium by Tom Prislak, President and CEO of Cedars-Sinai Health System, 2005 Partners in Care honoree, member of the Board of Counselors, and Honorary Tribute Committee co-chair.
Thank you, Jack, and good evening, everyone. I had the good fortune to meet Paul in the late 1980s when he helped us create our initial physician leadership development program. Meeting Paul was one of those blink moments that one has when you find yourself asking, how do I develop more of what he has? And so when Paul asked me to join him first as a guest lecturer and subsequently as co-teacher, it really afforded me the greatest learning experience and opportunity I could ever have. Simply put, I'm a better person, and there's a better than even chance that I wouldn't be standing here tonight if not for knowing Paul all these years. Now a few words about his brilliant career. Paul's work has taken him to both coasts and around the world. Educated at the University of San Francisco and Georgetown Medical School, Paul then served as a lieutenant in the U.S. Navy Medical Corps stationed with the Destroyer Division in the Western Pacific and with land-based units in Japan, Taiwan, Hong Kong, and the Philippines. Upon discharge, he returned to the States and earned his master's in public health from Harvard University's School of Public Health. He then spent 8 years in leadership roles at St. Luke's Hospital Center in New York. Paul then returned to Hong Kong, where he spent 3 years as a hospital director and then settled in Southern California in 1972, joining the UCLA faculty as a professor of health services policy and management. He's now earned Emeritus status, but not before serving as division head of the health services and hospital administration, director of the MPH program for health professionals, and founder of the Paul Torrens Health Forum at UCLA. Paul has endless curiosity about the healthcare industry. He's won numerous teaching awards and served on many boards, including as a member of the Partners in Care Board of Directors. Paul has a unique capacity to bridge the worlds of academia and the marketplace, and he's lent his expertise to a variety of local, national, and global initiatives, and has been sought after by the Office of the President of the University of California, 2 California governors, the governor of Kentucky, and in places as far away as London, Saudi Arabia, and China. For nearly 60 years, Paul Torrens has been a highly sought-after scholar, teacher, and thought leader who brings a global perspective to the creation of a highly functioning healthcare delivery system. He is our beloved mentor and all-around remarkable human, and we can think of no one more deserving of this Lifetime Achievement Award.
Now, it's our pleasure to call to the podium Paul's son, Jim Torrens, to accept this award on his father's behalf.
Thank you. It's my great honor and pleasure to accept this award on behalf of my father, Dr. Paul Torrens. Those of you who know my dad will not be surprised to hear that when I asked him about how he was feeling about receiving this award, he told me, "I've been so grateful for the chance to know and work with so many good people. I'm lucky to have so many good friends and colleagues. It's made life so interesting and worthwhile to work with them to help make healthcare available." So, as grateful as he is for this recognition, the true honor for my dad has always been the opportunity to know and work with so many of you in this room. Your colleagueship has been the major source of satisfaction in his professional life. He considers himself to have received just as much from you as he has given. I'd like to add that as his son, I am deeply gratified and moved to be here and to have this chance to understand this aspect of his life that much better. I will always remember this moment, as I'm sure he will. And Pop, if you're watching this right now, congratulations. You deserve this recognition, and I love you. Thank you to the Partners in Care Foundation and to you all for this special honor.